All right, so when you talk about active surveillance, essentially you're saying we're going to watch this prostate cancer. We're not going to treat it right away. We're not going to jump into treatment. We're going to watch it closely with PSA, digital rectal exam, repeat biopsy, maybe MRI. But we're going to watch the cancer and not treat it. This is done typically, anyone can have active surveillance, but it's typically reserved for patients who have a Gleason 6 cancer, usually your PSA should be less than 10. On your prostate biopsy, there should be 2 or fewer cores with prostate cancer. So if you look at your biopsy report and it says 4 cores are positive for prostate cancer, not that you can't have active surveillance, but these are the general criteria that if these are followed, there's low risk of advanced disease over the next 10 to 15 years. So 2 or few cores positive with prostate cancer. And then you don't want any core greater than 50%. So if one of those cores has 75% cancer, again, not that you can't have active surveillance, but most people would say that may be a little risky based just simply on that. So these are some very basic ways to know if you could actually qualify for active surveillance and safely watch your prostate with PSA, digital rectal exam, MRI, and repeat biopsy. Now, guys that are on active surveillance, guys that are watching their cancer and not doing any active treatment, about 30% of those guys will progress. Meaning, as you're on this active surveillance protocol, maybe a third of patients will, because the PSA will go up, or you'll find something new on an MRI, or a repeat biopsy will change things. Maybe 30% of those guys will now need active treatment, whether it's surgery or radiation or focal therapy or brachytherapy, any of those other treatments. About 30% on active surveillance will progress to actually needing treatment. So this is just just to get an idea of if you qualify for potential active surveillance. Again, anyone can watch their cancer regardless of what the scores are. But again, it's nice to have a somewhat of an idea of what's a patient that you could safely watch this cancer. So that's it. I'm Dr. William Stiles.